Medical Conditions and Procedures Explained. Welcome to the Medical Conditions and Procedures channel. This channel's goal is to educate, enlighten, and assist people to make informed decisions about their health. In this video, I explain the appendicectomy procedure. Don't forget to hit the subscribe button and turn on the notification bell, so you never miss any of our upcoming videos. Caution: this video contains graphic content. An appendicectomy, also known as an appendectomy, is a surgical procedure to remove the appendix, a small pouch-like organ located at the junction of the small intestine and large intestine. It is typically performed when the appendix becomes inflamed and infected, a condition known as appendicitis. If left untreated, appendicitis can lead to serious complications such as the rupture of the appendix, which can be life-threatening. The appendicectomy procedure can be performed through open surgery or laparoscopic surgery. Laparoscopic surgery is less invasive and often preferred when possible, as it usually results in a faster recovery and fewer complications. However, in some cases, open surgery may be necessary, especially if there are complications or the surgeon needs a more direct view of the area. Here's an overview of both procedures. Open appendicectomy. The patient is usually given general anesthesia to ensure they are unconscious and do not feel any pain during the surgery. The surgeon makes an incision, typically in the lower right side of the abdomen, over the area of the appendix. The abdominal muscles are carefully separated to access the peritoneal cavity. The appendix is identified, and any adhesions or surrounding tissues are gently moved away to expose it clearly. The appendix is then clamped and cut off from the surrounding tissues. The base of the appendix is tied off or sealed to prevent bleeding. The removed appendix is placed in a specimen bag or container to avoid contamination. The peritoneal cavity is irrigated with a sterile solution to remove any potential infectious material. The incision is closed with sutures or staples, and sterile dressings are applied. Laparoscopic appendicectomy. The patient is given general anesthesia. Several small incisions are made in the abdominal area. Typically, 3 incisions are made, with one near the belly button and others in the lower abdomen. Carbon dioxide gas is introduced into the abdominal cavity to create more space and improve visibility for the laparoscope. A laparoscope, a thin, long tube with a camera and light source, is inserted through one of the incisions, allowing the surgeon to view the internal organs on a monitor. Specialized surgical instruments are inserted through the other incisions. The appendix is identified, and the blood supply to the appendix is sealed off using surgical tools. The appendix is carefully detached from the surrounding tissues. The removed appendix is placed in a specimen bag and extracted through one of the incisions. The carbon dioxide gas is released, and the incisions are closed with sutures, clips, or adhesive strips. Sterile dressings are applied over the incisions. After the procedure, patients are usually monitored in the hospital for a short period to ensure they recover well from the surgery and there are no complications. Recovery time varies, but many patients can return to normal activities within a few weeks, depending on the type of surgery performed and individual factors. Please note that medical practices and procedures may evolve over time. Additionally, the prevalence of certain procedures may vary by country, region, and healthcare infrastructure. Thanks for watching. If you would like a medical condition or procedure explained, post in the comments below.